The story begins with vaccines as saviors of humans, saving hundreds of millions of lives over time. Humans were exposed and vulnerable and could do nothing as bacteria and viruses rampaged human civilizations until human ingenuity used the parts of the microbes themselves to act as shields against infection. Welcome to Beyond the Stethoscope, UCR Health's podcast series on health and wellness. I'm Dr. Naveen Raja, Chief Medical Officer of UCR Health and Professor of Medicine at the University of California Riverside School of Medicine. UCR Health's physicians and healthcare professionals are dedicated to supporting the health and wellness of the people who live and work in the communities we serve. Join me as we converse with physicians and professionals on achieving optimal health and wellness for you and your families. As with every medication, vaccines have side effects. There has been increased focus and fear on real vaccine side effects, which are appropriate, but also on some that are unproven. As a result, vaccination rates have plummeted, and diseases that have long been controlled may be making their way back. Measles was declared eliminated in the US in 2000. However, this year, in 2025, we've had a measles outbreak affecting 1,227 people across 36 states to date, resulting in 3 deaths. There has been 1 case in Riverside County as well. How should we think about the balance between benefits and risks of vaccination? What is the best way to protect our children? Let's ask an expert. Dr. Jean Russell is an assistant clinical professor at the University of California Riverside School of Medicine and a practicing pediatrician at UCR Health. Join me now in a conversation with Dr. Russell. Dr. Russell, so great to have you with us today on a very important conversation on measles and the vaccines. So thank you so much for joining us.
Thank you for having me.
All right, let's start with what's at the top of the news. So we're hearing there are 800 or more cases of measles throughout the country, and 9 in California, and perhaps 1 in Riverside County. So how should parents be thinking about measles and how to protect their children at this point?
Yes, so we've had several measles outbreaks, but this one is definitely hitting closer to home with that recent case out in the Coachella Valley in Riverside County. Still, the best way to protect yourself and to protect your children is the vaccine, because the problem with measles is it is super contagious. So having the prevention on hand is better than trying to isolate yourself completely if there is an outbreak.
When parents think about this, though, they might say, what is the risk to us in California? Is it really that big? I'm wondering if you have any thoughts on that.
Right now, there's like 900 and something cases in the US, and in California, we've only had 9. The last one was in a very local hospital. However, the risk, we don't think that the outbreaks that are currently going on in Texas and Kansas and a few other states are where our cases have come from. So as of right now, our cases, we believe, have all come from international exposures, which is good in terms of it doesn't look like there's any exposures currently happening within the community in California like there are in some other states, at least not yet. However, with air travel and how much everyone moves around, when there's an outbreak anywhere in the country, it is a big risk. And it's not like we're far geographically from Texas even.
What about prevention? There's always this question that seems to come up. Are there things that I can do to prevent measles?
Besides vaccine, it's super duper contagious. So the other way to prevent it would be to not have your children ever see any other children, which isn't a good idea, probably either. It's spread by coughing, it's spread by droplets in the air, and it can last for hours after somebody with measles. And somebody with measles can be contagious even a few days before they have any symptoms. So it's difficult to, and initially it looks just like a cold. just comes on with fever and some cough, some runny nose, and then everyone thinks of the rash, but the rash actually comes on after you've probably been contagious for many days. So from that standpoint, it's very difficult once it's out there to contain it.
There are some who are saying that maybe some vitamin supplementation, vitamin A, may help prevent measles. Is there any evidence behind that one?
I do not know of any evidence behind vitamins in preventing it. It's a very, very, very contagious disease. And the lucky thing is, I mean, of vaccines, this is one of the better ones. A fully vaccinated person is 97% protected, which is great. And if you look at the outbreak in Texas, there's only unfortunately, the people that have mostly been infected were unvaccinated, and the children that unfortunately died were both unvaccinated.
Very unfortunate. Well, you were talking about symptoms earlier.
Mhm.
So, what type of symptoms? Rash is one thing, obviously, but besides that, what other symptoms would parents watch out for? And when would a parent think about taking their child in to see the doctor or to the hospital?
Yeah, so we talk about the three big symptoms are cough, runny nose, and the rash, but they don't all happen at once. So if you have cough, runny nose, and rash, then you should probably be evaluated. That being said, that can represent a lot of other viruses that are very benign, unlike measles, that aren't going to cause a huge problem. So with those three, that's when I would say you should at least reach out. So usually it starts with feeling a little achy, having a fever for a few days, and then the cough and runny nose will come with that. And then a few days after that, you'll start with a rash, and the rash typically starts on the face, right up by the hairline, and then will spread to the body. And you can look online for pictures of the rash. I've actually luckily never seen this rash in person. But some other unique things, sometimes there's bluish spots on the top of the mouth, which can be very helpful in distinguishing it from some other things. But sometimes they're not there. And the rash can start, usually it's like 3 to 4 days after the other symptoms.
The initial things that would make a parent want to take the patient or the child to the doctor is really, did you say high fever and
Now,
rash?
fever can be in there. Usually it's fever, usually fever, rash, the red eyes. You can have conjunctivitis, which is just the eyes look very red, runny nose, and that rash.
Well, that's good to know.
Yeah.
Well, what about a child who's come into contact with another child in school, let's say, who was then diagnosed to have measles? Let's say that happens. What would a parent have to do in that situation?
So the first thing that you would want to do is probably contact your pediatrician and just ensure that what your vaccine status is from that standpoint. And they usually can instruct you on how to proceed. If you're unvaccinated, typically there is an immunoglobulin that I believe can be given, usually through the health department. But then there's going to be a at least 20-day quarantine. I think it's a 21-day quarantine.
Okay.
So usually, typically, it's going to be contact your healthcare provider and contact the health department.
Not that it's going to be common, but if there is a child who comes down with measles, is the risk of hospitalization or very serious complication a big risk or not a very big risk?
So the good thing about this vaccine is that it not only prevents against getting measles, and it also prevents against severe measles. So we think of severe measles as requiring hospitalization or, causing bad things like death. Um, so it prevents against both of these things. So if you're vaccinated, that's kind of the thing. I know I keep on harping on that. It's extremely unlikely that you would even catch it, let alone end up in the hospital. And if you're vaccinated and you do happen to unfortunately catch it, it even less likely that you would end up with severe disease that would require hospitalization.
In an unvaccinated child who gets measles, there is a risk, obviously, of a serious complication, but
Mhm.
most kids will come through that without a complication, correct?
Correct. I mean, just to give you some numbers at the outbreak in Texas, I was looking at it. I think it was the documented cases, 10% of them ended up needing hospitalization. And then of those, two patients passed away.
Again, that's a very, very unfortunate and very sad thing. I was just trying to make the point that most kids, fortunately, will do well.
Yes, yes. And I mean they that it goes back to like if you were born in the 50s or earlier, it is assumed because the vaccine didn't come out till the 60s, really. It was developed in the late 50s. But it's assumed that you had measles because it's so contagious that it was just hugely widespread. And so anyone that didn't have major disease or is still with us now, then yeah, it's assumed that they're immune.
Well, that's all really good information. Let's broaden out our conversation to vaccines in general, because there's so
Mhm.
much discussion today in the world about vaccines, what they do, how safe they are, whether people should get them, not get them. So that might be worth uh, some discussion, some conversation about that. I think one of the things that comes up in this conversation is, why do we vaccinate children with so many vaccines when the world generally seems safe in terms of infectious diseases in children? Wondering if you could explain that to parents.
Of course, yeah, I hear that a lot because obviously there seems to be more vaccines now than there were in the previous generation and the previous generation. So why are we adding all of these extra vaccines in when it seems like the world's safer? It comes down to individual vaccines. There's slightly different answers for each vaccine, but I'll give the example of the meningitis vaccine's a good example. Um, so meningitis is something that's very, very rare, the bacterial Neisseria meningitis. But if you get it, then you usually become so severely sick and so quickly that it's hard to make an intervention once you get it. So we used to only have this vaccine for people that were going to college, for people that were in like close quarters, like military and such. But then, those few people that were younger that got it and unfortunately it had terrible outcomes, um, it makes it worth it to protect those few lives. So maybe statistically, you're not very likely to catch this disease, but one death is too many if we could prevent it, especially in a kid. So now we offer it at 11 is typically when we give it in our office, and it's very well tolerated. So I mean, I look at it from a standpoint of statistics because not that any one of us is a statistic, but on a whole, you're much more likely to catch the disease and have a bad outcome than you are to have a side effect from the vaccine. So just looking at it like that, they're both very unlikely situations, though, for most of these illnesses. So I would pick the get the vaccine and prevent it.
So what you seem to be saying is that there are illnesses that occur infrequently, or that the complications are infrequent, but nonetheless, when the complications do happen, they can be rather severe. And so we're using vaccines as a way to prevent those uh, poor outcomes. And would it be unreasonable to think of it as an insurance policy? Because we have insurance policies for all kinds of things that are infrequent. Is it something like that?
Yeah. I mean, it's making the best decision that's in front of you to protect against something that hopefully is never an issue in your life. Um, But the other thing, I mean, I always, when I have parents that are talking about this, I always like to talk about the elephant in the room, which is vaccine injuries, which are real. Um, Vaccine injuries are super duper rare, um, but they do happen, and I feel like we kind of say that doesn't happen at all, and then you lose some trust in the conversation with patients and parents, and we're both coming from it from the same point of view. We both want the best thing for your kid. We both want the best thing for the child, and maybe we have a different perspective on it. But I think if you don't talk about vaccine injury, then you're kind of missing a big thing that everyone else is thinking about.
Yeah, I think that parents may be facing two choices. One is a rare complication of an illness or a rare complication of a vaccine. How do you help parents through that choice?
Well, I mean, I start talking about the experience for me when my first child was getting her first set of vaccines. And I was very surprised because I had reservations and I thought, I was already a doctor at this point, and I thought that I was very, very pro-vaccine. But when the prospect of someone injecting your child with like multiple things, especially when they're so little, um, the mama bear instincts give you pause. But in that moment, I took a step back and I said, once again, whenever I feel overwhelmed, I say, well, you can only make the decision in front of you. What is the risk for these actual injections? There is some risk, it is very minimal. What are the risks for these diseases? And especially I mean, in my family, I'm married to an Australian, so we do travel internationally a lot. And that's something that I think everyone should do at some point. But the rest of the world is very much not as safe and contained as we are. And anytime you really get on an international flight, that's another issue. So that was also playing with me, is that I want my daughter to have a, you know, beautiful and life where she's experiencing a lot of things, and I don't want her to be potentially held back by her vaccination status is another thing. I want her to go to school. I could never homeschool my kids. um, I very much admire any of those parents that are able to do that. It wouldn't go well for my family, but that's the reality of the situation, is that um, that was the conclusion that I came to. And it's something that you have to talk through with your partner. And if you don't feel comfortable talking it through with your physician, then maybe you're not with the right physician.
Yeah, it's really interesting you say that because I can fully identify with how you were thinking about it because we went through a very similar process with our child when our first child, where we had to really step back, take a pause, and say, "Do I really want to do this? The baby seems so small. Can the immune system really handle it?" We had all these questions, and we did end up vaccinating, but it was after a considerable amount of thought. And so I fully identify that. But what about parents who really feel that um, the immune system is so young? It's hardly been exposed to anything in the world, and we're exposing that immune system to these vaccines. Um, what do you say to that question?
I mean, the flip side of that is the immune system is so little and fragile, and they are at the most risk of poor outcome if they're exposed to these diseases at the same time because they're so fragile. So, I mean, my thought is that if I didn't protect my child and there was something that I could have done and I didn't do it, I would have, I don't know that I could handle that.
Yes, so that is the exact difficulty with this decision. There is a thought system out there, I should say, where, hey, if I just keep my child healthy, give them good nutrition, exercise, really care for them, make sure they get fresh air, play in the park, those types of things, will they not remain healthy?
Hopefully. I mean, that's always that's always the hope. But I mean, I think we have been in a bubble of herd immunity for a nice amount of time that we've gotten this idea, this almost delusion that some of these things couldn't happen to us. It's very much still possible, as we saw by the COVID pandemic, that things can explode out of control, unfortunately. So yes, let your kid run outside and play and be happy and eat good food to keep them healthy. That's all helpful, but you also want them to experience life and be around other humans. And with that comes risk of exposure to various things.
Earlier, you mentioned that the risk within the US may not be as great as the risk when we travel abroad. So when you think of it that way, is the risk lower in the US because we have been good at vaccinations and protecting our children for decades, and now we have brought down the incidence of these illnesses, and that has given us some confidence that this won't happen anymore.
Yes. Yeah, 100%. That's what I was saying with that. That's what that herd immunity term is referring to. There's many places that the measles outbreaks happen every single year in the world, and significant measles outbreaks and significant outbreaks of other things.
Yeah, you mentioned herd immunity. Now, the parents may say, "Hey, am I vaccinating my child to protect the herd or the population rather than my child? Well, maybe I just really care about my child."
Hmm.
So, which is the real reason to vaccinate? Are we vaccinating for to achieve population level immunity, or are we asking parents to vaccinate their child to protect their child?
I think to some degree that depends on the vaccine that we're talking about. For the most part, and for most vaccines, I would make the argument that we are protecting our child. And that's I mean, that's what I do. I think my kids are vaccinated against everything that you can be vaccinated against. But I see it as the added bonus is that you're also protecting, your neighbors, your other patients. I also have patients that can't get vaccinated right now, for instance, are undergoing chemotherapy, or on immunosuppressives for autoimmune diseases. Um, and they can't get vaccines, especially vaccines like the measles vaccine. So, yes, you're protecting your kid, but it also protects those less fortunate kids that are already trying to do all the things, but to protect them, keep them safe. But there's always a risk of exposure.
Yes, that is something that's missed sometimes in thinking that everybody has the same level of risk, but there are kids in our population, in our communities that have various conditions that lowers their ability to respond to these infections. Let's now talk about some safety issues with vaccines. One of the things that's said about vaccines is they have not been tested adequately, that we're giving things that have not been proven to be safe, at least not proven to be safe at a certain level of expectation of safety. I'm sure you've encountered this in your practice. So, how do you address that concern of parents?
I mean, we have a very rigorous testing policy for vaccinations. Anything that to get anything through the FDA that, especially for children, because it's difficult to test on children, is is very tough and rigorous. They have to first make sure it's effective and first make sure it's safe and then make sure it's effective. And so there's like multiple levels of testing. And we, opposed to other countries, we actually have, I think, even more testing than many countries. You can look back at, for instance, thalidomide was a medication that was approved in Europe for use, and the US hadn't made it through all the testing in the US. The US was still doing some testing on it, and it had passed in other countries, but it turns out that there was long-term horrible effects for thalidomide on unborn babies, and we were largely spared from that because it hadn't gone through in the US yet, because we were still testing it. So, I mean, I think our track record's pretty good for testing on a whole. And most of these vaccines, even the newer ones, have now been out for a long time, especially in the standard schedule. Like as I mentioned before, MMR's been out since the 60s and it was developed in the late 50s. And there was, I mean, the other thing that always comes up, which I always try to bring up when I have a vaccine hesitant parent, especially with MMR, is the discussion of MMR and autism. And sometimes parents don't want to bring it up, but that is one thing. So this all came from a physician in Great Britain who purported that he'd found that the MMR vaccine was related to causing autism. There was some causal effect. Since then, that physician had, I mean, and this was more than 20 years ago now, has lost his medical license, and it's one of the most studied, disproven things. So in huge studies and in what we call meta-analysis, where they combine multiple studies and then analyze it, it's been shown that there isn't a link. It's just it's very tough because we still don't know what is causing autism, and it's probably many things that are causing autism. But it's yeah, that's one thing that we can rule out, it looks like.
Well, that's really good to know. There are other complications that parents are afraid of. Guillain-Barré comes to mind as a thing that's mentioned.
Mhm.
So what about these other things?
So they occur, but they are extremely rare. I've had one patient that had Guillain-Barré from a vaccine, but you can also get Guillain-Barré, unfortunately, from many of the same viruses that it's basically it can be triggered by a vaccine, but it can also be triggered by the virus. So not getting vaccines doesn't mean something like Guillain-Barré cannot happen to you. And that child actually that had Guillain-Barré made a full recovery and actually tried to get that same vaccine the next year, but I had to tell him and his parents that he never can get that vaccine again.
Well, I'm glad that child did well after that. Now, question on anaphylaxis.
Mhm.
So there are reports that children get vaccines and some rarely have an anaphylactic reaction, a severe allergic reaction, if you will. What about what about that as a risk?
So once again, extremely, extremely rare. Usually the reaction will start very soon after the immunization is given. So there's a good chance that you'll still be in the doctor's office.
There's one last thing I want to ask you about vaccines, because
Mhm.
this comes up too. Uh, what about things that are in the vaccine besides the main ingredient, if you will, that would produce the immunity? I'm talking about things such as formaldehyde,
Mhm.
etc., in the vaccines. And parents will be concerned about having those chemicals injected into their children as well. So, what are your thoughts regarding that?
It sounds worse than it is, generally, is what I would say. Like, for instance, for the formaldehyde, formaldehyde's naturally occurring in our body. It's a byproduct of some normal chemical reactions. And this is an extremely small amount of formaldehyde. So on a whole, yes, I mean it is in general not a good idea to inject formaldehyde, but this is such an incredibly small portion um, of the whole vaccine that it is deemed safe. And that has not been shown to be a cause of any vaccine injuries or side effects that I know of.
Well, that's good.
But it does keep our vaccines, I believe, safe of getting contaminated as well.
Well, I think you've really helped us understand a lot about some of the details of the vaccination. But there is a new generation of vaccines manifest now with the COVID-19 vaccines, the mRNA vaccines. And there's a lot of discussion around the mRNA component of the vaccines by saying, hey, are we injecting genetic material into our children? Can this have genetic consequences for my child? Is there some effect that's prolonged, that's ongoing beyond the immune reaction to the vaccine that can happen in their bodies? What do you think about that?
Um, it's it's tough. I always say that we don't know everything, and that definitely applies to the COVID-19 vaccine because and COVID in general. So from my understanding, the current science is that there is absolutely no way that the vaccine can change or affect your DNA. It's the way that it's made with sort of this type of genetic material is just a new way, but there are different kinds of vaccines that, I mean, they're all made with a bit of genetic material from typically some organism. And that's the way they work. They come into the body and sort of simulate that response of the virus or the bacteria without causing the disease. And the way that they tell your body to react is that teeny bit of genetic material so that it can understand that it's coming again the next time if it's a real infection or
So this is the
exposure.
type of genetic material that is a communication system, a messenger, rather than something that would change your DNA or your genes permanently,
Hmm.
correct?
Yeah. Yeah, I think that's a great way to put it.
All right. I have to ask you this question because you have a practice, a very busy practice in pediatrics, and I'm sure you have parents who fall on both sides of this type of thought process. Some who are wanting to give vaccine to their children, some who are sitting on the fence and want to consider both options, and perhaps some who would not want to give the vaccine to the children. For the parents who don't want to vaccinate their children, and they seek pediatric care from you, how do you approach that?
I usually will ask them what their thoughts and feelings are on vaccines. And before I will share my thoughts and feelings on vaccines personally, because unfortunately, a lot of these parents have been ostracized at other practices or by other physicians. So they come in with this question's kind of scary, and the first time meeting me is scary with this question. But I typically say I am very personally, I am very pro-vaccine, but I see my role as a physician, as a pediatrician, as supporting what you want to do. I see that as me guiding you with my medical knowledge to help you do what you want to do. So if you absolutely do not want to vaccinate, then I can kind of help you on what to look out for some of these things. And I will actually encourage those parents to bring their kids in quicker if they do seem ill. Um, than I would maybe a fully immunized child. But it's, yeah, so and we can discuss if it's something that you want to really minimize the vaccines, then we can have the discussion. I'm very open to having the discussion about which vaccines are required for school versus which vaccines are required or are recommended, and some of the nuances of my experience between the two. So I really look to the parents' goals and how I can help them because in the end, we are both just trying to keep the kids safe and healthy. And that's what the parents want. That's what I want. So yeah, that's how I see my goal. And I mean, I've had colleagues that I've had heated conversations with about, in the past they used to say, "Oh, we won't let them in our practice if they're not fully vaccinated or if they're unvaccinated." And that really only hurts the children. And that's what we're here to keep the children good. And usually those parents aren't doing it because they want something bad to happen. They're doing it because they're also thinking in a very passionate way that they're keeping their kids safe. So, sometimes we meet halfway, sometimes we don't, and that's totally okay. I would never pressure anyone. But I mean, in the end, you have to have that kind of relationship. And if you don't feel comfortable with your pediatrician and whatever vaccine status you're at, then you should probably seek other care.
Well, it's so good to hear that your approach is so much built around a trust relationship with the parents, and that you seem to approach this with shared decision making with parents, and you're both working obviously towards in the interest of the child. So that's really great to hear. Tell us a little bit, if you don't mind, about your practice. because it seems so interesting how you approach your parents and your children. And I know that you're a very popular pediatrician, so I'd love to hear a little bit about your practice and how you approach it, and how what part of Dr. Russell is reflected in the practice.
Hmm. Yes, we are busy. Let's see. I mean, I just approach it. I really just see every child as they come in, and I just love children. I think children are they're interesting, they're fun. They haven't some of the things, the social things that we've have been taught out of us are still there. They're very fresh and innocent and real. And so I try to talk to the kids immediately, which sometimes confuses parents because I mean, I'm even talking to babies. And I just try to see them as a whole person. I try to ask them questions as much as I can to involve them in their own care and to kind of model to the parents that this is also, these are full, huge people that need to be recognized as such. Sometimes, unfortunately, it makes me take a little longer in certain rooms, but if there's ever anything, I always try to tell parents if they're upset because I was running a little behind because something came up. If there's ever anything that came up with your kid, I would 100% sit down and devote all of my time and everything to figuring out what was going on and helping you. So that's kind of how I approach it.
Yeah, that's amazing to hear. You seem to bring so much of yourself to your practice, your personality, of course, but a lot of your own values and the way you think about things is what you seem to be bringing to your practice, and it's so wonderful to hear that.
Yeah, I really enjoy it. I feel bad for you guys that have to talk to adults all day. Seems very boring.
Well, we enjoy seeing adults, but I could certainly imagine that it's somewhat more fun to work with children.
Yeah. Even on my worst day, I get to snuggle with some babies.
Well, Dr. Russell, it's so wonderful to have you. I think you've been such a wealth of information for us, and you've clarified so many concepts that are murky in today's world. I really appreciate you joining us and providing all this information to parents and their families. So thank you so, so much.
Thank you. Thank you for having me.
Thank you for listening in to Beyond the Stethoscope. This podcast was brought to you by UCR Health, the clinical enterprise of UCR School of Medicine. UCR Health is comprised of a team of physicians, specialists, and healthcare professionals. With medical offices located throughout Southern California, UCR Health is growing to meet the healthcare needs of the region, bringing innovative, compassionate medical care to the communities where we live, work, and play.